it does get confusing, but we are clarifying that as you will hear after DHEC is reporting or having their conversations with the CEOs. They started at 11 o'clock, I think. We met prior to that. We talked prior to that. We had a final meeting yesterday afternoon at some length, and I think that those categories are going to be clarified and broadened. And if there's something else needs to be done, then I'll do it. We've got this. I have the authority under the emergency powers to change those things. I can't change the law, but I can change a rule, and we can do whatever is necessary to be sure that this vaccine gets to the people. Now, there's again, someone asked, you can't just run in, get a shot, and run out. Also, all that has to be registered in a big computer. It's a federal computer called VAMS. For the nursing homes and long-term care, they have another computer. It's called Tiberius. I don't know where it is, but it must be huge because it gets all the information from all over the country about where the vaccine is going. You can't just walk in and understand how to operate, to enter that system. It takes some training. That's one of the stopgaps, one of the things that's slowing us down. That training is available at DHEC. The hospitals have gotten that training. Others are going to have to get the training before they can give the vaccine independently. So this is not just like getting a shot and going on about your business. It's more complicated than that. But the point is, it is not moving fast enough for the people of our state who have endured much in this virus and who have worked through it better and stronger than other states. So we're going to be sure that South Carolina is our economic health and our educational health and our physical health are all tops, because when the pandemic hit, we were on the way up economically. Our prosperity was rising. We took a dip, leveled off. Other states went into the basement. We leveled off. We never closed, and we are going to see that our people get this vaccine. Everyone who wants it. Things like that will need to start happening soon. That's the direction in which we're going. But again, you have to understand there are limitations. You can't just drive through and then drive away. But we are going to see that we move as quickly as possible, much faster than we've been moving. And the good news is the hospitals all agree. The providers are eager to participate. It's taking longer than we wanted, but we're speeding it up right now today.
As far as your conversations with hospital executives, have they been willing to abide by that January 15th deadline? Have they been easy or difficult to work with throughout this?
No, they've been wonderful to work with, and DHEC is meeting this morning to discuss that deadline and possibly others with them.
As far as DHEC, there have been efforts, that President Keeler, for example, I think we mentioned this last year, pre-filed a bill to split up the environmental side and the health side of DHEC. Where do you stand on that? Do you believe that the agency should be split, or do you think it's fine the way it's working now?
I think it probably should be split, but that's because it's a huge organization. It would logically fall into two parts, but that's going to be the subject of a vigorous debate and analysis. And what we've learned in this episode, I think, will be instructive in deciding what to do, how to make DHEC function better, whether as one agency, two, or perhaps some different fashion. But we have to. It takes a crisis. It takes something like this where you really put pressure on the system to fully understand where the weak points in that system are. And we're learning some things now that will benefit us in the future.
Governor, besides the deadline and clarification of some language in the plan, is there any other red tape that you or lawmakers could cut to kind of help speed up this process of vaccine?
Any that we see that I can cut, we will cut. Shauna?
How will the vaccination effort play into your decisions to open the remaining restrictions, whether that's the 11 o'clock bar curfew or the
250 limit, and the more more people that get the vaccination, then the better off we are. But I have no intention of imposing more restrictions. We've taken off everything except those that you mentioned, unlike other states that are struggling financially because they're killing jobs. When you close down a business, that business, you can't open the door 3 or 4 months later and give them some money and expect them to pop back. It doesn't work that way. So we didn't do it that way. But we hope that this vaccination effort will have an enormous impact. But again, it is a growing with the other providers that are signing on, the drugstores, the pharmacies, all the various other types of clinics and offices. It ought to work much faster than it has been. But I will do whatever is necessary to keep our team together and have them working at maximum efficiency and speed to get that vaccine out to the people.
Governor, when it comes to manpower, some hospitals have said, at least for them, that is a bottleneck, is using the state National Guard at all on the table in addressing this.
Well, the National Guard has been involved, and they're also involved, as you know, in preparing to set up hospital beds if necessary. If the hospitals get full, and you take some people out and put them, those that are not in intensive care, to open up more rooms. Our National Guard's been involved from the very beginning, and they're involved in this distribution process. But we have plenty of offices, businesses, the drug stores, the pharmacies, the doctors' offices, as well as all the hospitals that are available. National Guard can participate in that as well. We have the outlets. We've got to get the people. We've got to get the people in there, and that's why we're putting this deadline. If you want the vaccine, and you're in this first group, which is a big group, then you need to go on and get your shot, make an appointment, go, because most of it is by appointment because of the complications I mentioned, the paperwork that's necessary. Go ahead, get that shot, or make an appointment for after January the 15th if you can't get there before. But if you don't do that, then you move on back in the line. That your priority will be up. So we want to urge people to let's get moving.
I have a off-topic vaccine question. Tomorrow, Congress will start debating the Electoral College certification. We've seen at least 4 House Republicans who say they're going to object to that. Do you agree with their plans to object to that certification, or do you think that Congress should vote to certify the Electoral College?
I think that there are many issues that were raised in this campaign. Some observers say there are more allegations and issues raised in this presidential campaign than any other. That they know there have been some disputed elections prior. But I think if is anyone who has a question that they want answered, a legitimate legal question, something that there's a forum for, I think they should take advantage of it. I think that we need to have confidence in the election, and people, if there's a way for them to get their questions answered, then they ought to get them answered. If there's not, then there's not.
Should it be objective? I mean, do you support their position to object?
I think there are a lot of questions raised. I've never seen so many questions raised in so many states by so many different people. Never seen that before, although I have read about some disputed elections. But again, if anyone has a question, there is a procedure, and they're following that. The senators and the congressmen, and several of them from South Carolina, the congressmen, they're following those procedures.